Welcome to another edition of Talk City Greensboro, produced by GTN, featuring interviews and events happening around town. It's an easy way to stay in the know while you're on the go, to keep up with what's going on in Greensboro city government. Subscribe to Talk City on iTunes, Stitcher, Google Play, or SoundCloud. Filling in for host Josh Johnson, I'm Devin Smith, and alongside me is our senior producer, Carlos Castellanos. How you doing today, sir?
I'm doing great.
You're coming up on, you're getting ready to eclipse Josh as far as how many podcasts you've done this month. But thank you for joining me again.
Yeah, of course. And thank you, everyone, for joining us. We appreciate it each and every time you tune in. Today we have a very special guest. She's way smarter than Devin and I.
Guilford County. I don't know about that.
Guilford County's Public Health Director, Dr. Iulia Vann. Welcome.
Yes, thank you. Thank you for having me here. Good afternoon, everyone. I know everybody's super excited for the weekend. I know that I am, to have a little bit of downtime. So I'm really happy to be here with you guys.
That's very sparse these days.
Yes, it is.
Yes.
Well, speaking of that, you became the director of the Guilford Public Health Department at the probably one of the craziest times in our history. So how was that transition for you?
Yes, it's definitely been crazy. I did not anticipate for this to happen, and I have to say that mainly I feel honored that I am in this position at this time, and being able to use my experience and expertise to just lead the county's effort into the COVID-19 response. However, this is really not how I thought that my health director career is going to start. I thought it was going to be a little, easing into the position. I have been with the county for about a year and a half now, initially in the assistant health director position. So that has helped me a lot to learn the department, the services, my team members, and just be all on the ground already. So from a learning curve and adapting to the department, it hasn't been extremely difficult because I was there already. I knew my team. We were working together for a while now, so that really helped get things started. So initially I was named interim health director for the first 2 months, and that was the very first week that coronavirus started impacting the country in North Carolina. So that was March 3rd. I am probably never going to forget that date. And from there, the first 2 months in my interim position, trying to understand all of the complexities of the work that needs to be done, and actually going and doing it with my team and organizing and coordinating everything has just been the main focus. And then moving into the permanent health director position was just very easy. And again, I just felt extremely fortunate and honored to be able to be offered this opportunity, and it seemed like I was doing a pretty good job to gain everybody's trust and to make them feel like I am the right person for that position. So it's just been really interesting. That's all, probably the only word that I could think about right now.
Yeah, I think it's been interesting for all of us.
Yes.
Especially for Carlos, since he has school-age kids, which leads us to our next question. Because
you are one of us. Okay.
Because school's been a hot topic, seeing that August is approaching fairly quickly.
Yes.
From a health perspective, what do we need to know about our kids and what we need to do to get our kids back in the classroom? Since I know a lot of people have mixed feelings about it, but at the end of the day, that's the way the world works, is our kids go into school. So what are some of the things that we need to know about that as we transition and make different plans to trying to find some sense of normalcy around that?
Sure. Do you guys have about 5 hours to talk about that? Okay. I'll try to stay on time, but it is a very complex and deep conversation, and there's so many different moving pieces. There's so many different things that we need to think about when we're thinking about school and reopening, or kids going into school in a virtual environment, in a hybrid environment, or in a in-person environment full time.
Yeah.
So each one of these pieces have different levels of measures that we would want to put in place. So it's just the $1 million question, almost. But we've been working very closely with the Guilford County schools and trying to find the best way that this can be done in order for the kids to be safe, the teachers and the staff to be safe, and then, of course, for the parents to feel comfortable that their kids are going to be taken care of. I know very well, because I have school-age kids myself. I have a 6-year-old, so he's transitioning into first grade now, and I have a 3-year-old who's in daycare. So it's been really hard for the last few months, and now going forward, not really knowing how that's going to look like. I know it causes a lot of anxiety for myself and for my family, so I know that all parents are feeling the same way. So the main thing that we've been talking about is the prevention measures that we're already doing outside of the school. Mm-hmm. So the masks, the hand washing, the social distancing, all of these 3 very important points. How do we take those and put them in the school environment so they can fit? Because we know that what kids do regularly are not what adults do. Mm-hmm. So the main thing that I wanted to mention is that all of these measures and the protection that they give is cumulative. So the mask cannot be taken by themselves, and the hand washing cannot exist within its own universe, and the social distancing is not going to be as effective as they all 3 become combined. So when you think, the reason why I'm starting with this is because there are so many different opinions about, the kids, especially the younger ones. They're not going to keep their masks on all the time, or it's just going to be a challenge for that. But yet, when you're thinking about the social distancing and the washing hands and how they all kind of overlap and layer on top of each other, the fact that one kid for a few minutes might not have that mask on until the teacher mentions it or, puts it back on, is still going to provide protection for the rest of the kids. The same thing with social distancing. We know that kids are kids. They want to go and play with their friends, and they want to be around them, so they're not going to walk around with the ruler and the measuring tape to make sure that they're 6 feet away from their friends that they haven't seen in months. Mm-hmm. So we know that that's going to happen, but how is that going to be done in relation to the other ones? So doing all of them at all times might not be possible, because we just need to be realistic with the group that we're talking about. But as much as we can and as frequently as we can, we know that those are going to be very successful measures to keep our kids safe. So we just need to think outside the box. We need to really understand the dynamic of the classroom, the dynamic of the school, and with those things in mind, just move forward. Yeah. So those are just a piece of the entire complex situation that we're in right now.
Definitely.
Yeah.
So I know everyone is now focused on public health,
Yes.
because of these times.
Yes.
However, I'm sure there's a reason people should have always been worried about public health. Can you tell us the importance of public health in general?
Absolutely. So I am so glad that you guys are bringing this up, because I can spend forever talking about public health. And to us, public health professionals, now it is a crazy time, and it is constant work and countless hours and stress and exhaustion. But at the same time, this is what we've been trained for. This is what our mission is, and this is what our passion is. So to be in a situation where we can really display the level of commitment that the public health teams have all across the world and in our nation is just a really good time to bring everybody together and to remind everyone that public health is all around us. It impacts people from the moment that they're born until the time that they pass away. We have every layer that you could think of when it comes to somebody's life that we're impacting. So think about that wonderful restaurant that you want to go to, that you love going, that you're taking your wife to on your anniversary, and that you've spent so many wonderful moments at. We're inspecting that restaurant, and we're making sure that the food that's safe served there and the practices that the restaurant has are following all of the guidance that they need to in order for that food to be served and cooked in a safe way. Think about the pools, for example. You know, you're taking your family to the pool this weekend, and we're right there with the little cup of water to make sure that we test it, that water is going to be safe for you to use the pool. So those are some areas in which public health is working. Going on the other spectrum of pregnant women and kids and infants, looking at the outcomes that pregnant moms have to make sure that everybody starts in life with the best outcomes that they can through a healthy and safe pregnancy, to the most appropriate development in those kids. All of these are public health initiatives and programs that are happening all the time. At no given time do we pause them. Also, communicable disease response in general, it's one of the public health mandated services that we're doing day in and day out. So the COVID-19 pandemic is definitely an unprecedented situation because of so many numerous factors, starting with the fact that it is a novel virus. But communicable disease response in general is not a new function of public health. There are 75 reportable diseases in North Carolina that our communicable diseases nurses are working on every day. Not at the scope that we're working at right now, but anything from foodborne to STDs to vaccine preventable diseases, all of that is part of public health. Immunizations, making sure that our kids receive the immunizations that they need that will protect them for the rest of their lives. Working with social determinants of health that we know that impact health, and that a person cannot be taken out of the environment that they live in order to determine if they're going to have a positive or negative outcome. Looking at transportation and education, poverty, racism, and everything in between. We know that all of these things are impacting the health of an individual. So just like I've started the conversation, public health is all around us all the time. In general, I like to think of us as kind of like the silent guardians that are just watching things and making sure that everything stays safe, and we're always vigilant, but we're not always in the news. We're not always in the eye of the public. We're just doing our jobs and loving it. And situations like this one right now, it just brings all of this forward. So it is a little different, now, because we don't get the publicity and the attention that we're getting now on a regular basis. But we just want to make sure that everybody understands the importance of it. It's all about, and I guess to just kind of go back to your question and to make it short and sweet, the importance of public health, I would say it's the work that we're doing towards prevention. So it's making sure that you prevent something before something bad happens. Preventing that accident by wearing your seatbelt or your helmet if you're on a bike. Preventing the cancer that might happen through tobacco cessation programs and screening, such as colonoscopies, for example. So the word prevention is what defines public health pretty much, making sure that you don't go into the hospital and try to treat something that could have been prevented. Diabetes, hypertension, all of these chronic illnesses that could be prevented or delayed through healthy diets and exercise and just a healthy living in general. So all of that is the importance of public health and the environment, and each and one of us is playing a part in that.
Yeah, and I mean, you went over a list of things. I know I had written down, like housing being a part of it, the economy being a part of it, education, violence in the community, drugs, all of these certain things kind of play a part in how public health does their job.
Absolutely.
So before we let you go, though, we've got to ask the $1 million question that every time someone gets a public health official in their presence, can you please give us an update about Guilford County and where we stand regarding the pandemic, as far as cases, different things, and just remind us of the tips that we've been trying to push out there as government employees to make sure that we're curbing the spread of the virus? Absolutely.
Oh, I'm so glad that you are asking me the question. I would have been surprised if you guys didn't ask me that. So as far as the status of the cases in Guilford County, we are continuing to see positive cases every day. We're averaging between 70 to 140 cases every day. So some days we're seeing less, sometimes we're seeing more. We haven't had a just dramatic spike in cases. All of these cases have been growing constantly over time. So that is still concerning. We just haven't had that, very rapid spike in cases over the last few months, and I hope that we're not going to see that. But it's still very much concerning, and making sure that we're still putting the message out there that coronavirus is in our community. There is community spread, and we need to be as careful as possible at all times. We're continuing to see deaths in Guilford County. We have been extremely impacted in this particular area in our long-term care facilities, and it's just so tragic and heartbreaking to see the devastation that this is bringing in those families, and all of the families that have lost somebody to COVID-19. So it's just something that we're tirelessly working on, and making sure that we're still keeping that curve fairly flat is still one of our goals going forward. We're working in so many different arenas, from the communication that we're putting out, making sure that every aspect of our community has some form of guidance going forward, from businesses to daycares to hotels to grocery stores, long-term care facilities, and so on and so forth. Everybody's looking at us and relying on us to help them find those best practices and operations to keep their staff and team members and clients and people that are coming in and out, or the ones that they're interacting with. So keeping in mind the 3 W's. I know that sometimes we sound like a broken record, but we would not do that unless we would know that these are successful measures to try to curb the spread. And it just goes back to what I've mentioned earlier. They're all cumulative. You can't take one without the other, and doing all of them is just going to really prove to be successful. It is never going to be perfect. And we know that there are areas in which we could probably do better. And we know that there might be situations in which we could do more. But right now, trying to do the best that we can is everything that we can, pretty much. So the message to our community members is to continue to wear face coverings as much as possible, staying 6 feet apart, washing their hands, trying to avoid large gatherings, trying to avoid being out in the public, is still the message that we're putting out. We know that life is trying to get back to some type of normalcy. We know that people are tired of hearing the same message over and over again. We know that people are just anxious and they just want their lives back, and I completely understand that. But in order for us to be able to do that, we need to work together to curb the spread, be able to move forward, and come back on the other end and on the other side just stronger together. So this slogan that I think has been out there is really showing the picture that we're working towards for all of us to be able to just get back to some type of normalcy, including the schools, including the businesses and the restaurants and the economy. All of it is going to happen. The faster we get ourselves together and work together to do this, the faster it's going to happen.
Yeah, definitely. Well, Dr. Vann, we definitely appreciate you coming and sharing all that good information with us, and I'm sure the citizens of Greensboro will be they'll be glad to hear it. And I know, like you've said, we sound like broken records. We've got a million PSAs on the channel and different things like that come out saying the same old things, but it's what we have to do together for it to start working.
Yeah, even though it's hard. Is there a website or anything you can direct our listeners to sort of get all that information?
Yes, absolutely. So we have created a website where our community members can go to get information about testing and general information about COVID-19. Also data that is Guilford County specific, and that is www.healthyguilford.com. So healthyguilford.com, and testing sites, links to other useful information, links to the CDC, links to our community partners, Cone Health, Triad Adult and Pediatric Medicine, the Old North State Medical Society. All of these wonderful community partners are doing a lot of work in our communities. So this website, the healthyguilford.com, just links kind of everything together, and they can start there and gather more information.
Yeah, that sounds great. Thank you so much.
Yeah, thank you.
Absolutely. Thank you for having me, and I appreciate the opportunity to share this information and have this conversation with you this afternoon.
Yes.
Of course. Thank you.
Stay tuned in weekly by subscribing to Talk City Greensboro on iTunes, Stitcher, and Google Play. And don't forget, you can download the podcast from SoundCloud.
That's it for this week. Thank you for tuning in to Talk City. Be sure to watch GTN for your official source for news and information about the city of Greensboro. GTN is available on Spectrum 13,
AT&T UVerse Channel 99,
and North State Channel 31.
GTN is also available on Roku and the city's website at greensboro-nc.gov. Have a good one.